Thanks, Nikita. You really raised the bar. So, it's really an emotional moment for me, and I really congratulate Prasad and the whole team to having put this together, because it's something very significant in the age care scenario or environment for the state of Goa. And I'm supposed to talk on aging gracefully. Aging gracefully. It really feels odd to be speaking on aging gracefully after graceful people actually speaking about their own life experiences, and we have to learn from them. We don't learn from books, we learn from them, because they have so much to teach us. And that is the message that all of us have to take home, that there is a way of aging gracefully. You can see this painting over here, wherever it is, there it is. And there is a nice painting. The minute you enter the facility, it talks about forever young. And that is the key message. We all want to stay forever young. When we ask people, they will say, I don't want to grow old. But yet people say that they want to live long. I've done a study, it was called the DIL project. DIL stands for Depression in Late Life. It was how to prevent depression in late life, and the initiative that we called it the DIL initiative. And in that project, I spoke to a number of senior citizens, older people, people about the age of 80, people about the age of 60, about the age of 70. People are going to get old, or whatever definition of old is. And the theme or the key message that came from everyone, because we wanted to develop a service that would help them live a happy life and prevent depression in their life. So what does that? What are you really afraid of? They all told me, Doctor, we don't mind dying. That is not something that we're afraid of. We should not be bedridden. We shouldn't be dependent. So that is what people really are afraid of. When they're saying, I don't want to grow old, it is not about the age that or the number that they are worried about. They're worried about, if I grow old, will I be dependent on someone else? Will I not be able to do my activities of daily living? And if that is the case, then that is something I'm really paranoid about. I'm really afraid of that. And that is something that should not happen. So that is the definition of aging gracefully. There are various methods of or ways that we need to age gracefully. I always say this, that our life is a journey. It's a journey from two alphabets. You might have heard this before. From the alphabet B and D. B is birth, D is death. Okay, from birth to death. Everyone goes through this journey. There's no two ways about it. The key message is what happens between B and D. And between the alphabet B and D is the alphabet C. C stands for the choices we make. And that kind of defines our life. The choice that we make, our lifestyle choices, because all these conditions that causes dependence on others are actually lifestyle diseases. And if we change our lifestyle, we can make a big difference to our life, and we can do what we all want to do, age gracefully, live with dignity, have a good quality life. That is what we can do if we change lifestyle. So what is it that we want to change lifestyle? What type of lifestyle we want to change? I've been working in this area for the last, say, 25 years, because dementia was my topic for my thesis. When I was doing my MD, we always have to take a research topic, and I wanted to challenge myself to do something really different and something that others had not done. And I'd said, I want to do a study on dementia, much to the awe of my professor at that time. He said, what, dementia? Does it even exist? So I did a study by going house to house to see whether people with dementia dementia exists in Goa or not. Because in my whole MBBS career, we had not seen a single case of dementia. But to my surprise, we saw it was so common. When we visited the houses, I saw so many people. In fact, the first house that I went to, and I was speaking to a nice lady, she herself had dementia. And it was so common that I felt that something needs to be done for people with dementia. And that's how it really started. One thing led to another. And we tried to develop better services for people with dementia. And I really liked, Prasad shared his life experience. Necessity is the mother of invention. He went through a situation where he realized the need for something like this, and that is a need that he didn't only satisfy the need for himself, but he said that how can this be a project that we can help others in need as well. Because in Goa especially, we have this problem I call it the PICA syndrome. PICA is parents in India, children abroad. Parents in India, children abroad. So children want to help. It's not that they don't want, they love their parents. They want to do something for them. But the care arrangement system that was there earlier, the joint family system, somebody or the other would be there, some neighbor would be there to take care of anybody who's old, or pitch in for help. That is kind of breaking up. Everyone in the family is now working. And if you really have to take care of someone who requires care 24/7, then it means you need to take big sacrifices. You kind of have to leave your job, and people have done that. People have, I know children who have not got married because they had to look after their parents. I know people who have left their job because they have to look after their parents, who have these kind of chronic need that have assisted living facility is required for some people. And therefore that lacuna that was there in the state of Goa. There are many, many old age homes. We are blessed to have many, many old age homes. But old age homes in Goa do not take in people with dementia. If you go, that is one condition they will screen you about. Can you remember? Can you do your work, every work? If you cannot do that, then sorry, this is not the place for you. And so people who really need help are the ones who do not get help from these kind of facilities. And so Aaji care facilities really come at the right time to help people to deal with that. So aging gracefully. And there's another part of my talk. I really like that talk that they gave me. They said, unlocking the secrets of brain health. Unlocking the secrets of brain health. What unlocking means? Unlocking means if something is locked somewhere, you need to put a key and then open that key, and it's going to unlock the secrets of brain health. And so they gave me the keynote address is mine. So everyone felt that I'm going to give you the key of how you unlock those secrets of brain health. But I want to tell you, the key to unlocking those secrets of brain health is not with me. It's with you. The key to unlock the secrets of brain health is with you. And you need to understand that. And the earlier you understand it, the better it is. So if you want to really unlock the secrets of brain health, when do you do it? You'll say that these conditions we're talking about, older people, that probably is about age of 60. Somebody will argue, no, not 60, it's 65. And no, WHO says something else. And so somebody will say 75, somebody 80, whatever. You'll talk about those numbers. So when do you think we should unlock these secrets of growing gracefully and aging gracefully, or unlocking the secrets of brain health? The answer is, it's never too early and never too late. It's never too early and never too late. So as early as possible, we have a program that I had started called the Minute Initiative that we do in schools, wherein we train school children on how to adopt brain healthy activity such that it's good for them in the future. At the same time, we sensitize them to brain-related problems that could take place in the elders staying in their house. So if they know grandmother who's having memory-related issues, then this could be a red flag. They could tell their parents, okay, no, this is somebody had come and told us that these could be a sign of a disease, and this person needs, grandma needs help from a doctor. Can we take grandma to a doctor? Because a lot of people, even the houses that I went to, I told you when I was doing my thesis, I went house to house, and I said, there's so many people with dementia. Did they know they had dementia? No. 90% of those families didn't know that their loved one over there had dementia. They felt like, now it's difficult, it's aging, it's very difficult to deal with grandma. And the more you try to help her, the more difficult she makes it for us. I'm trying so much, and this is what is happening, and this is the type of treatment I get, but this is my cross and I have to bear it. So people just feel that it is supposed to happen and nothing can be done for people like this. So that's where we go wrong. We need to understand that life does not end with the diagnosis of any disease. There's a lot that can be done. Yes, there is no cure for most of the reversible forms of dementia, which means there are some reversible forms as well. Some forms of dementia can be nutrition-based, maybe some growth in the brain that is causing that. Maybe thyroid-related problems can be causing dementia and memory problems. You need to see a doctor. So you need to understand these red flags of dementia. If somebody who is growing old and repeatedly having memory-related issues to an extent that they cannot do their work that they were doing every day, that is a sign that they need to get themselves examined. I'm not saying it is dementia. I don't want you to make the diagnosis. Let the doctor do his job. Take him to a doctor who can make the diagnosis. Because that is the second point that I realized in my study. Almost 50% of those people who didn't know the diagnosis of dementia had actually gone and seen a doctor. They had gone and seen a general practitioner. He gave him some vitamin pills and sent them back. And they'll treat acute condition. If you have a fever, they will treat the fever. Have a cold, they'll treat the cold. But they will not go into this part where a person is forgetting and cannot do activities of daily living, and there is help required. Help is not always necessarily medicines. So when we say go to a doctor, it is not that the doctor has to give you medicine. We demand that, we feel that we are paying the doctor some 1,000 rupees fee, so you better give you some 10 medicines, to make paisa vasool of that thing. But no, most of the treatment is actually non-pharmacological in these cases. So it's the care the carer who really has a very, very important role to play. I told you this is a very emotional moment for me because we have been working in this area trying to develop a home for people with dementia for quite some time. For the last 25 years, when Dr. Shiko was, some of you may know him, he's the one who started the Department of Neurology at the Goa Medical College and also was the founder of the Dementia Society of Goa. And he was working for brain health in a big way. He celebrated his 90th birthday this year, and I was there for his birthday. A week later, in fact, just a few days later, he passed away, unfortunately, at the age of 90. And he always used to say this statement: carers of people with dementia are like angels on earth. Carers of people with dementia are like angels on earth. And this is the message I want to give Prasad and the whole team who will be looking after people with these major care demands, including people with dementia, that you are like angels on earth. It is also something that reminds me about our late Chief Minister, Manohar Parrikar sir, who was also very keen on developing these services. He met us several times, and in fact in the Parliament also he has mentioned about developing dementia services in the state of Goa. We remembered him on his birthday just 2 days ago, and we remember him every day because we need visionary leaders like this in the state of Goa, where life expectancy is very high. You know, Prasad was talking about life expectancy in general, 75, 70. Life expectancy in Goa with the good health services that we have got is, is an example. We can see people over here who are living much beyond 80, and just not living much beyond 80, living well or living gracefully much beyond 80. So that is something that we are achieving because we have good health facilities and because you have understood the key. And you have, rightly what they shared is perfect. If you talk about dementia itself, the numbers are really staggering. We have around 55 million people with dementia in the world, and by 2050, this is supposed to triple. So 150 million people with dementia. If we use our preventive strategies, we can change these figures. We can change the way the world will look at older people if we have to act now. We can change the future. So we are the ones who kind of would change this future if we put things together. I was fortunate to be part of the Lancet Commission on Prevention of Dementia. So this is something that Nikita mentioned. And really we looked at what is the evidence that we have in research that can actually prevent, or can we really prevent Alzheimer's disease and dementia? And we found out, fortunately, with looking at very hardcore evidence on research around the world, that we can prevent dementia to the extent of 45%. That is a big number. 45% of the cases of dementia can be delayed or prevented if you follow certain practices. There are 14 kind of guidelines as of now, and we are still looking into other research to see if anything else could be helping. And I know there could be many more factors that could be helping. Now, what are these factors? Things like education. Okay, so education is a very good protective factor, especially education earlier on, before the age of 20. If you keep your mind active, and that's what Nasi was telling us, keep your mind active, that is the key message. Whether it's through education or any other method, you're learning some skill, doing some work, but do something that requires your brain to function and to think and really put it to test. Because the key thing now, and the very positive research that has come out, now we used to say before, you can't teach an old dog new tricks. You've heard of that before. So you can't teach old dog new tricks. They used to say that. We learned that. But that is not true anymore. We can teach people, we can learn things, new things at any age. Age is no bar to learn new things. And we need to challenge ourselves at all points of time. We sometimes feel this social isolation that came up during COVID time, and happened to be the norm. That is actually a big risk factor for conditions like this. Whether it's depression or dementia, social isolation is a big risk factor. Many older people tell me, my friends now have passed away, and those who are there have gone. My family has gone abroad. We can work new ways. Wherever there is a problem, there is a solution. You just need to understand the keys within you. And you have to take the decision to bring about a change. You can make new friends. There are ways that you can do that. And we started the Memory Cafe just for that. Memory Cafe is an online platform where people can connect to people. We use songs, something that Harriet uses a lot. Harriet is a very cool friend. She's from the US, but also has roots in Mangalore. And she is a caregiver herself. And she was a caregiver herself. And really has a lot of experience that she brings to the table, trying to use different forms like art, music, dance, and increasing or stepping up the cognitive exercises through this program. I told you education is important. Besides that, we also found many other things that could be of help. Hearing impairment was a big risk factor for dementia. So a lot of people who grow old cannot hear maybe. Cannot hear is not a problem. But if you don't do anything about it, is a problem. So if you have a hearing impairment, make sure that you use hearing aid, because it's very important to get stimulation. Our brain reacts or grows because of the stimulation we get through our visual stimulation, through our touch, through hearing. So these are all ways that by meeting somebody, by talking to people, our brain is activated. We need to keep ourselves activated because of that. Address hearing important. To the extent of 7% we can prevent dementia by addressing the issue of hearing impairment. Vision impairment as well is important. So if you have cataract, get the cataract fixed. The various very easy ways of fixing this. Traumatic brain injury is a risk factor. So if you had head injury, it can cause problems. So people playing football for something, head injury with the ball sometimes, that can cause problem. Other thing, what is good for the heart is good for the brain. So things like high blood pressure, diabetes, cholesterol. LDL cholesterol is a big risk factor for dementia, and this is the kind of new research that has come up. Alcohol consumption is a problem. Obesity is a problem. So check your weight, keep track of it. Go for exercises, important. Smoking is a risk factor for dementia. Depression and social isolation, a big risk factor for dementia, and that has to be addressed. The new research has shown that loneliness in older people is equivalent to smoking 15 cigarettes in a day. Loneliness in older people is equivalent to smoking 15 cigarettes in a day. So imagine the risk that you're not smoking, you're not drinking, it's just that you're lonely, but that is putting you at equal risk of smoking 15 cigarettes a day. So you need to understand that you need to fight loneliness. There has to be a way by which you do it yourself. There has to be a way by which the government makes it easier for you to achieve that. You'll say, okay, I want to go around, I want to go and do my own shopping, but the roads are so busy, it's not very age friendly. So we need to have age friendly services. We need to have facilities that will help you reach out to people and live a very healthy life. I don't want to take much time, but I want to tell you this kind of a secret of staying happy. And it's really in the word happy itself. And the word happy tells us about H, which says health. H is for health. You can't be happy if you're not going to take care of your health. So get yourself examined earlier. Check yourself for diabetes. Keep your diabetes under control. I have done the study called the INDIBE study for ICMR, and we have done the study in Goa and other union territories also. And we found that the prevalence of diabetes is the highest in the whole country, is the highest in the state of Goa. 26.4% of the people above the age of 20 have diabetes. Diabetes is a major risk factor for heart disease, for brain disease, for dementia, for so many diseases. If you want to prevent all those diseases, simple measure, check yourself for diabetes. If sugars are abnormal, get it treated. Keep the sugars under control. Same thing for hypertension. Keep it under control. Cholesterol, keep it under control. So H is for health. Health also depends on your diet. So keep track of what you're eating. Now, we can afford more. We can eat, we want to rest. How much we're going to cook every day at home? Home food. I'm bored of that. I want to eat in this restaurant, I want to eat in that restaurant. And if you don't have time to go to the restaurant will come to you. Zomato and Swiggy will just get the food home. So there is a lot of eating that happens through food outside. Food outside for the restaurant to survive, they have to make the food tasty. You cannot have a restaurant who's going to give you food that's not tasty. You're not going to go to them again. So the only way they make it tasty is by adding oil, by adding butter, by adding salt, which is going to make it unhealthy for you. So too much, I'm not saying don't go to a restaurant, please do. But if you do too much of food from outside, keep track of what it is. Sometimes you go to a restaurant, Subbu, where are you? So we go to a restaurant, you have unlimited thali. Now you say you're paid for it, unlimited thali, so you need to do paisa vasool, which means you need to eat as much as possible. So you'll just keep on eating and you have a large portion size. Keep track of your food. Don't go for the large sizes. Eat little, all right, but don't keep on eating, because that is what's affecting you, and that's going to impact your health in the long run. If you want to age gracefully and want to unlock these secrets, the secrets are within you, and you need to do that. So health and diet is the first H that health is telling you. The A of happy is active aging. So active aging, there's no doubt about that. Nasi said it very clearly. All the people who came here and told us about the way the secrets of their aging gracefully, they spoke about activity. Activity is key. I'm not telling you to run a marathon. I'm telling you just do walking. You just try to walk But keep in mind, start low, increase slow. Start low, increase slow. Just because I told you and I motivated you, I don't want all of you going and running it back home or something and then having a problem or climbing all stairs. So whenever possible, climb the stairs. But if you cannot do it, don't push yourself. Start low and increase it slow. That's very key. Because when you exercise, there's a factor called BDNF in the brain. I don't want to get into the details of that, but BDNF factor is an important factor. It's like a fertilizer. That's a simple way I'll put it. It's like a fertilizer for your brain. So your exercise increases this important factor in your brain that acts like a fertilizer, keeps you happy, keeps you stress-free, helps you deal with or prevent all these kinds of diseases that will come on in the future. So it's very, very important to exercise. I cannot stress it much. If you don't want to remember anything that I said, remember only one factor. Active aging makes the difference. That's what the WHO is trying to push. That's what the government is trying to push. And is that an alarm, by the way, that tells me that I've crossed my time? That is making noise behind. Okay, fine. So that is what you need to keep. A of active. P of happy is have a sense of purpose. So people will say, okay, what is the purpose? When I was working, there are so many things that I wanted to achieve. There were so many objectives that I wanted to achieve. And so it was driving me to do things. Now there's nothing. I have to get up and wait for my lunch and then get up and wait for my dinner and then go to sleep and get up the next day. And there is nothing that I have to do. So develop that. You know what Nasi was saying about of gardens? We're not telling you to go and watch the gardens, look at the gardens. We're telling you to go and plant the plants. Do that actively. We're not telling you go and look at the painting. We're telling you take the paints and paint. Whatever it is you do, paint, do something. Action is important because that is going to make the difference. What we have through our memory cafe, it's just an online group, it's a WhatsApp group. You know, people in their houses itself do something. Somebody will do some crochet, somebody will do some mandala art. So we have different workshops for them, it's free of cost. And they will show each other and they will praise each other and say, oh wow, excellent. So somebody feels good, others you have done a nice painting, it's there, there's no one to look at it. So this way we are developing their own friend circle and their virtual friends. We have not met many of them. Online we have met people, but it's making a big difference because they have a sense of purpose, and that sense of purpose really drives everybody. Happy has two P's. The other P is peace. It's very important to be at peace with yourself and understand the peace, meditate, because stress is a big, big risk factor. So understand peace, surround yourself with people who are going to keep you happy. It is no point surrounding yourself with negative people, trying to correct them all your life and feeling frustrated that you're not being able to correct them. That is not your job. You have done it before. You told them, in good faith. But if they are negative, keep them away from your life. Surround yourself. There are so many people. We have, a country with so many people. People are not, we're not shortage of people. So just find who it is who's going to be positive, because they're going to make a difference in your life to help you age gracefully. And the last word of alphabet of happy is Y. And Y is you. Okay, Y is yourself. Think of yourself. If we live our life where we keep thinking of other people, we keep thinking of what I can do for my son, what I can do for my husband, what I can do for my wife. We keep thinking of other people and we ignore ourselves. We need to understand the importance of self-care. Self-care is not being selfish. I'm not trying to tell you to be selfish. Think of yourself and no one else. No. If you want to take care of someone else, you have to be healthy and be taken care of yourself. That's what we tell you. Even when you go on a flight, when they say the oxygen supply comes less and you have a child with you, put a mask for yourself first and then put for the child. So you need to take care of yourself. Self-care is very, very important. Keep this message in mind. Happy. And I think you will be happy and be able to age gracefully. That is the simple, fundamental truth as far as aging gracefully. And once again, I congratulate Prasad and the entire team, Subbu, and all the work that he's done. I kind of know, because he's been keeping me updated about all this. I really congratulate the support, all those who have been supporting you, whether it is the Sarpanch and the local MLA and the government, to do this. I think it's going to be a kind of a role model center for a lot of people, and it's going to help in a big way. And I think you can start a chain of these kind of homes in other states as well. So all the best, Prasad. Thank you all for your patient listening. And if there are any queries, I'm most happy to take them towards the end. Yeah, thank you.